Patient Care Medical is a best practices clinic. For 15 years we've been on electronic medical records, incorporating new technologies as they develop into a small independent practice. Common conventional wisdom is that electronic medical records and the attendant tools are not affordable by small practices. And we find exactly the opposite to be true, that if you are looking to reduce your costs, reduce overhead, improve your medical care, have better access for patients, in our case in primary care, that the use of a good electronic medical record, secure messaging, portal, e-prescriptions are essential to being able to run an effective practice. The short-term steps are to examine your workflow, examine your business plan, and then decide whether or not the cost-benefit ratio in the short term is worth moving this year. Realizing that there's an economic disincentive coming in a couple of years that's going to change that equation. But right now, clinics should be preparing at whatever level of implementation they are, from no EHR to a clinic like ours, which has a fairly sophisticated, already implemented workflow. What else do I need to do? What kind of hoops do I have to jump through? Do they make sense? Will they lower my costs? And if not, is it going to be worth the reimbursement that I'm promised? A lot of that is still, I think, up in the air, but those are the steps we take. It's examining our workflow and our business plan to see how these things fit in. The biggest challenges facing most practices today is their sense of their own business plan. It's where do I find the capital? How will this reduce my cost? How can I internalize all these external pressures on me to have certain behaviors when I personally don't see how that's going to help my practice, and can I afford it? And that's probably the biggest problem. Second, meeting the regulatory environment, there's going to be a disincentive financially to not be up and running within a couple of years. And so you've created an instant conflict within the physicians. They kind of feel like they have to, and yet they're not sure why they're doing it. The answer to that really is education. It's examples of clinics such as ours where we can show a really good business plan for you, that there is hope in the future, that HIEs will be developed to the point where it will make sense for you to join them.